I've kind of learned in meeting with you that this is really an unrecognized problem, probably for many reasons. I can guess like stigma, probably people are a little bit worried about losing their jobs if they raise awareness around this. And also I think that many employers probably just think that these people are not necessarily in their population because they're working, right? Like it would be challenging to actually, work. But I've learned from talking to you that this is actually a much broader problem in the employed population. And it's not even necessarily just in specific sectors, but it's a broader problem than many people realize.
They did an assessment prior to COVID. There was about 27 million people at that time in our country, roughly a tenth of the country, that were using substances in a harmful way, and they met criteria for addiction. 46 of the 49 million people have alcohol use disorder. They are working. They are working. I can tell you the vast majority of our patients, almost all, are working full time, still going to work every day, and many of them drinking at work. You just don't know. And on average, they're consuming, the ones that come to everyone that's come to our program, on average 17 alcoholic beverages a day, every single day. What is the cost? What are you paying for this employee that does not have this problem and this employee that does? And on average, it's 300% more.
Wow. Hello, everyone, and welcome to Spark Spotlight Series. Today, I have Dr. Amanda Wilson with me from Northstar Care. So we are going to talk today about kind of the unrecognized problem of alcohol and substance use disorder across employer populations. This is really, a topic that, is near and dear to Dr. Wilson's heart and something that she is doing to really innovate in the space and drive awareness in a space that many of us don't know that much about. So Dr. Wilson is actually a serial entrepreneur. She's been working in this space for many years and has a really successful track record and career working in this space. So I'll kick it over to Dr. Wilson to introduce herself.
Oh, thank you, Lindsey. It's such a pleasure to be here. I can't tell you how much I love working with you here. So I'm Dr. Amanda Wilson. I'm an internal medicine doctor. I'm also board certified in addiction. After a decade of working in hospital medicine, I actually started doing addiction medicine about 16 years ago. And I founded the very first company that did office-based medical supervised opioid use care back then. There weren't OBOTs yet, office-based opioid treatment programs yet. So we invented that really. And Clean Slate was the very first, and it's grown to 87 clinics across the country and has cared for over 110,000 people now who have opioid use disorder. And I learned a lot, from building that. And one of the very first things I learned is that in-person care becomes quite a barrier for many patients with addiction. They've many times lost jobs. They're, especially opioid patients, sometimes they're really struggling with finance, and many are on Medicaid now. So that became really difficult. If you have a young mom with two kids, how are they going to get to the office every week, right? When they don't have a car. So I decided to pivot around 2017 and built a second company that was the very first telehealth company for opioid treatment. That company is called Boulder Care. The first company is Clean Slate, and the second is Boulder Care. Boulder was the first telehealth program, as I mentioned, and there have been numerous companies to follow in its suit. And then that again was opioid focused. So in 2020, COVID hits, big, massive rush of people, unfortunately, developing alcohol use disorder. So we decided to build a company that would address all substance use with a special focus on alcohol use because of the prevalence of the problem, which is not widely understood. Mm-hmm. So I'm very excited to tell you all about the company, and thank you.
Awesome. Well, you have a great track record. So I'm sure that Northstar will be, off to a wonderful, wonderful start. So would love to hear a little bit about, kind of the unseen challenge in the workplace around alcohol and substance use disorder. I know that, I've kind of learned in meeting with you that this is really an unrecognized problem, probably for many reasons. I can guess like stigma, probably people are a little bit worried about losing their jobs if they raise awareness around this. And also, I think that many employers probably just think that these people are not necessarily in their population because they're working, right? Like it would be challenging to actually, work. But I've learned from talking to you that this is actually a much broader problem in the employed population. And it's not even necessarily just in specific sectors, but it's a broader problem than many people realize. Can you tell us a little bit about what you're seeing in the data and what you've kind of recognized working with employer populations?
It is a much more massive than people understand. And they also don't really recognize how that's impacting other downstream costs for employers. So I'll talk about all of those things. I'll start with the National Survey on Drug Use and Health. They do it every year. They analyze how many people are struggling with substance use. They did an assessment prior to COVID. There was about 27 million people at that time in our country, roughly a tenth of the country, that were using substances in a harmful way, and they met criteria for addiction. By the end of COVID, that number was 49 million. So COVID had a massive impact on our country, and frankly, the mental health of our country has not improved since. It's honestly continuing to decline. So there's the way people are coping with that when they are coping with it legally is using alcohol. And 46 of the 49 million people have alcohol use disorder. They are working. They are working. I can tell you the vast majority of our patients, almost all, are working full time, still going to work every day, and many of them drinking at work. You just don't know. They are not going to tell you. They aren't. They're terrified of having the employer find out because they just don't know what kind of reception they'll get. And frankly, stigma is widely still held against this. People think this is a choice, and we'll talk later about why it's not. But they think it's a choice and that people are just lazy or just that's the life they want to live. And none of those things are true. So we're not actually addressing the disease the way we should today. And we'll talk more about how Northstar does it and why that's beneficial. But there's so many issues that hit employers that I think are really important to mention. The first I'll say is I think everyone that I've spoken to talks to me about absenteeism as a major issue for them, and it's been growing. And usually what I'll say to them is that's your alcohol use disorder problem because, now that we're at 49 million people, it turns out to be 1 in 7 people in the US, but 1 in 5 employees, 1 in 5. So the workforce is really soaking in it, quite literally. And so they're still working, and on average, they're consuming everyone that's come to our program, on average 17 alcoholic beverages a day, every single day, every day. So they go home at night and they'll be drinking 10 or 12. And then in the morning, they drink a little bit before they go to work. And then they drink a little bit at lunch sometimes. And then they can start up again at 4:30 or 5. And that is their life pattern. And they're even heavier on the weekends. So that is what we're seeing. And that is actually the average. That's what's so scary. We're not having patients coming to us and saying, I really would love to not be binge drinking on the weekends. I should stop at 2, but I end up at 5. And those aren't patients that come to us because they're so early stage, like, I don't have a problem. I just go drinking with my buddies and they drink that much. So they don't think it's a problem. They don't know that this is a progressive disorder like cancer. That's stage 1, binge drinking. Stage 2 is everyday drinking. Stage 3, you have everyday drinking. You cannot possibly have a day without it. And stage 4, you're having multiple medical complications, pancreatitis, esophageal cancer, heart attacks, stroke, many things that people don't know. So when we're looking for alcohol use disorder in data, the thing that I've run into ubiquitously across every broker employer and consultant that I've worked with, across every employer that I've met with, when they look at their data for it, what they're searching for is alcohol use disorder, the diagnosis, that code, or they're looking for opioid use disorder, the code. And what's also not widely known is as physicians, we were all trained to never put that diagnosis on a patient's chart. Don't add that to their problem list. Because if you put it on their problem list, I swear, if they go in for a heart attack, they get treated differently. They don't get the assessment that they deserve. This literally happened 2 weeks ago. I sent a patient in. I'm an internist. I know what a heart attack looks like. She was having one. She was having crushing chest pain. She'd had jaw pain. She had hypertension. She had all the signs. We sent her into the ER. We even called the ER to tell them to expect her, that she was on the way. She got there, and they basically were about to discharge her not a half an hour later.
Oh my goodness.
They did not do any workup. They didn't get an EKG. They just found out that she had alcohol use disorder and she's faking it.
Wow.
So we don't put that diagnosis down. However, when you look up the diagnosis codes, if you search for alcoholic pancreatitis, alcoholic encephalopathy, alcoholic hepatitis, then they have the disease. So we've figured out a brand new methodology that we're willing to do with any employer, any broker consultant, any TPA. We will happily do analytics on your data. Because when we do the analytics, what we're doing now is extracting those diagnoses, the definitive diagnoses that clearly prove that a person has this disorder. An example would be the patients taking Suboxone. They definitely have opioid use disorder, right? So we can look for specific things. We went through all 75,000 CPT codes to do this. But now what we're seeing is an average of anywhere from 17% to 24%. And there are certain types of organizations that will be closer on that high spectrum. I'll give an example: teachers and nurses. It's surprising. They're at 24%. And they're at 24% because they were the folks hit hardest through COVID. COVID caused a massive surge of this, and the biggest surge was among moms with children under the age of 5.
I can understand that.
So that's teachers and nurses, right? So they were hit hard. So they were drinking very heavily, and we have a big percentage of them in our program. But there's construction, there's warehousing, there's transportation, there's so many industries, labor unions, right? So many industries where the incidence is quite high. Veterans, it's about 40%, for example. So it can go as high as that.
Wow.
So anyway, I there's that piece. The next piece to know is the cost associated with that, right? They're not knowing that if you just look for rehab, that's only one cost, and less than 8% of people with alcohol use disorder even seek treatment. So you're not finding them by just looking if they went to rehab. You have to find them with these diagnoses because the doctor doesn't write down alcohol use disorder. But then I can tell you, what is the cost? What are you paying for this employee that does not have this problem and this employee that does? And on average, it's 300% more.
Wow.
If they're paying $6,000 a year for their employees that don't have the problem, it's 18 for those that do. We further limited it down to the top 10% most expensive. On average, they were costing between $50,000 and $60,000 per year per employee, those top 10%. So we did that extrapolation and found that there are companies losing millions and millions of dollars because they think it's just a stroke. They don't know that the person had alcoholic pancreatitis last year too. That stroke is alcohol, but they attribute the stroke to medical expense, and it's not. It's actually an underlying problem. So employers are hot thinking, tightly right now and focusing very much so, and rightly so, on expensive things, MSK, oncology, obesity, and diabetes. Those are really big focuses. But what I've been telling people is actually alcohol is the underlying cause for many patients of those three things. 65% of workplace accidents are alcohol or drug related, National Safety Council data, 65%. They're also the ones that came out with 17% as the average across the country. And I would argue it's actually higher because they didn't use our methodology. It's actually quite higher, I believe. There is a range. So there's those for that. There's diabetes, obesity. Let's talk about that. The average person comes to our program pre-diabetic. Their hemoglobin A1C is about 5.8. By the time they leave our program, they're not. They've lost 35 pounds on average in our program, not on a GLP-1, just not drinking. That's a lot of calories they're consuming. We get rid of their hypertension. Alcohol is a big cause of hypertension. That's why stroke and heart attack are much higher in this population. So if we get their hypertension controlled by stopping their alcohol, they get better. They come to us on 2 or 3 hypertension meds. They're on none when they leave. So all of these things will stop some of these issues in their tracks. And the last one's cancer, and that's the biggest one. Esophageal cancer, 500% increase. 500%. That diagnosis is $1 million a patient. So we figured out that our program would pay for itself if we just prevented the esophageal cancers that those patients develop, just that one diagnosis.
Wow.
Let alone all the others. So this is a huge issue. And then I'll lastly touch briefly on this. I mentioned absenteeism. NSC data, again, National Safety Council. On average, people with alcohol use disorder are missing 37 total days per year. So 32 additional days above normal. If you have a massive alcohol use risk, for example, labor unions, right? And just use that, or teachers now, they're definitely missing more days. It's a significant percentage of that population. They're missing 37. That is a lot. And then what do they do when they do discover it, and that few people that they figure it out with, right, that they could possibly know, in those patients, they send them to rehab. They come back. And rehab, this is what's not known either. Rehab works nationally. This is in the literature. 13% of the time. It's successful 13%. So on average, people return to use. 55% of people who went to rehab are drinking again back to their usual level within 1 month, 55%. By the end of 6 months, 86%, from a study that was just done last year, 86% are back to drinking full force. So they've just spent $50,000 on a rehab stay that literally did nothing but pull them from work for yet another month.
That's great.
So we don't pull patients out. They're still working. No one knows. Like, they just get into this incredibly personalized one-on-one virtual program that, we're completely managing and working with that patient 20 hours a week in early treatment, but around their life schedule. We see them on the weekends, at night. We'll see them early in the morning. We'll work with them so they can stay at work. We do breathalyzers all day, so we know if they're drinking at work. So we can do these things that actually advance how we manage this disease. And I can get into how the company treats this disease differently. But we have an 86% success rate. We are 700% better. It has been proven. It's been statistically modeled. We are, without a doubt, and we're the first company in the world to offer a year-long guarantee after the patient's done the year of treatment with us. Our program's a year long, not a month. You don't get better for these things in 30 days. So it's a year-long program. The second year, if the patient has any return to use at all, they will come right back to their original team of providers. We'll immediately take them back and care for them for however long it takes to get them completely stabilized. And I don't care if it's 6 more months of care for free.
That's wonderful. Yeah, I think also on the methodology and just kind of the unrecognized problem with employers, I mean, you have such great data to support this, and it makes sense that, no provider is going to diagnose somebody with alcohol use disorder. And that's part of the reason for kind of the unrecognized problem that we're seeing. But would love to kind of understand, given that the status quo is like obviously not working for employers and that they also don't even fully recognize that this is such a prevalent problem in so many different types of populations. I mean, I think you said 17 to 24% of the population is absolutely an insane number. How did we get here where the current system is failing people so badly? And what are employers doing today to address this? Is it mostly just traditional type of rehab programs that aren't working and EAP? Like, what are employers doing today to address this, or are they just not addressing it oftentimes?
In most cases, frankly, because they're not aware, we ask the question, why is this system still in place that's so broken? Right? It's actually entirely a long held belief system. Our country was soaked in AA back in 1930. Quite literally, nothing has changed since 1930 in terms of the care that patients get who have alcohol use disorder. It is over nearly 100 years of misinformed treatment that was never in any way were physicians or any other medical providers ever encouraged to participate. And what happens in rehab, people don't know. They think it's a magic box. They come in, they come out cured. And what happens to that poor patient is their employee. What happens to them? They get strip searched. They have to give up their phone. They can't have their phone for an hour a week. They're not allowed to talk to their family for the first 2 weeks. Can't say hi to their children. They're not allowed to talk for many hours of the day. They're held in groups from 8 a.m. till 6 p.m. And then once a week, they see a counselor, no doctors, no medications, no medical management. If they have opioid use disorder, the day they come out of rehab, they have a 40-fold, right? And not 40%, 40-fold increase in their risk of death because they don't put them on any medications. So patients should never go to rehab if they have opioid use disorder. Alcohol use disorder, they'll be dry for a month after, half of them, and then the rest will trickle back over the next few months. That's just what happens. So it's ineffective care that's actually quite cruel. They spend the whole time they're in there being told to do the steps. One of the steps is, how many people do you have to apologize to for how horrible you've been for having this disease? If we did that with cancer, right? Breast cancer, you go to a support group, you have a counselor with breast cancer too, right? But if you just put someone in a box who has cancer and says, you're just going to get support groups and counseling for your cancer, you don't need that chemo stuff. How would we expect for their success? I think what employers are doing right now, understandably, is somewhat passive because people widely believe rehab works, right? It's a widely held belief that AA works. AA works 8% of the time. Eight. That's it. So everybody goes to AA. They just don't know that most people leave it. The vast majority of them are leaving it early and quick. They don't go back because it's focused on what it's focused on. It doesn't work. So patients know that rehab doesn't work. People who have it have friends who've been, or they've sometimes gone themselves already and they're under your employee, you don't know. But they know that doesn't work, so they want something different. Employers have been, not through any fault of their own, but reluctant to bring this up. No HR person wants to say to their employee, Joe, I'm sorry, you have to go to rehab. That's a horrible discussion to start, and nobody wants it. And the employee feels terrified to tell the employer, right? So it's not their fault, and no one's known that there's another alternative, and we're that new the alternative
Yeah,
now.
I could see how employers would just not even want to get involved in this because it's messy, and it can feel a bit invasive. And to your point, like, I don't think that it's widely recognized how cruel the treatment is. But I mean, the way that you describe it certainly sounds that like that's a very cruel treatment to put people through. And nobody wants to do that to their employees, right? They're in the business of taking care of their employees. I know with Northstar Care, you guys are doing a lot of things different. Like you brought up the guarantee, and I know you're integrating like genetic counseling and all kinds of, more innovative, clinically proven methods to actually get these success rates. I think you mentioned 86% success rate. So would love to hear a little bit more about how you guys have just kind of reinvented this whole way of treatment and how you're getting those great success rates.
I mean, it's taken a while. We actually spent an entire year, my co-founder and I, who has she's a data scientist, she has a PhD in research, and she's been a professor for 30 years, teaching graduate level research and statistics. So that viewpoint, right, me as an addiction physician and she as a data scientist, our ability to distill what's occurring in the literature, the medical literature is extremely effective. I'm looking at it clinically, and she's looking at it from, is this really statistically accurate what they're saying in this paper? Because it's often not. But she can look at the tables and understand. And so we read 2,600 papers. We read every article in the entire medical literature across the world that has been published since the year 2000 on alcohol and substance use disorders. We found out a lot of interesting things. We found out that in Europe, they've been detoxing patients at home for 30 years. We still send people to a box and it's quite cruel and they go cold turkey on everything. It's just a horrible method that's actually not needed. So we learned a lot. That's how it was started. So what are the key things that differentiate us? Number one, I'll start with genetics. We use genetics to measure, to determine what treatment someone should have for cancer, right? We use it for many things today. Some reason they're not using it. Again, no doctors are involved in treatment today, so that's why, I believe. But when you use genetics, we pull the entire genome. Every patient gives us it's an anonymous swab. The company doesn't even know that they're who the patient is. But when we get that data back, we wrote a Python extractor, we pull out all the key alleles that change the course of our treatment. Here are the things that impacts. What med's going to work for the patient? I know what meds aren't going to work. That's also just as important. What a dose will they probably need? Some people are really sensitive to meds. Some people need a lot higher dosing than others, and it tells me that. It also tells me there are key nutrients that you have to replace in a person who has alcohol use problems. I'm focusing there as an example, but in that group, they're magnesium, B12, folate, thiamine, and they all need to be replaced. When a patient lands in the hospital, they give them that IV. But when they're home, no doctors give that to them. And I'm not really clear why, but they don't. So they develop nutritional deficiencies that have to be replaced. Well, if I have to give them B12 to prevent dementia, because that's what it's doing,
Right.
some patients need to have it injectable. You probably know people who get monthly B12 injections. And that's why they have a genetic need. They don't absorb it orally. Genetics tells me that. So I can put together a nutrient regimen for patients that restores their brain health. And in fact, at the end of the first month of care on our nutrients, 25% improvement in their brain health. On cognitive function testing, we actually test them. We test them all through the year, and at the end of the year, 40.3% in cognition. Imagine an employee who's currently functioning for you with an IQ roughly around 80, and now they're suddenly 115, at the end of this year. They're much better able to do their job, stick to what they're doing, pay attention, and they're not impacted. They're not coming into work impaired. So it's a radical change. What's the next thing? Medications. There are meds that really work. When you treat heart disease, someone goes in the hospital, when they're there, they come out from heart attacks on 5 meds. Why? Because you have to attack heart attacks with several different things. You have to keep the platelets from sticking and blood pressure and cholesterol, right? They're on all of these things. Well, same with us. When they come to our program, they're on 5 meds at first. They're not on them forever, but they're on something to help them sleep. 100% of people with alcohol use disorder can't sleep. They all wake up at 2 or 3 in the morning, 100%. They also are very depressed and anxious. What alcohol does is it strips your brain of all the serotonin and dopamine you have. There's nothing left. So they're incredibly anxious, 100% of them, and very depressed, many of them suicidal now. So we have to treat that acutely. That starts to get better as we use the nutrients and as they come off of alcohol and we restore their gut health, right? Because the microbiome is really important to how we live and breathe. And they don't have one because alcohol kills it, right? So we help them restore that. So medications are key. So we use something that's radical. We use gabapentin. So that is my workhorse. That medication is, so alcohol, the receptor that it stimulates in the brain most is the GABA receptor. That's what causes the brain to go, ooh, just relax, right? So that takes you down. And it's why people like
Right.
it, a comfortable feeling. But, you can use gabapentin to hit that same receptor. So the beauty is I can take someone drinking 20 drinks a day and do 18, 16, 14, right down over the course of 2 weeks and put them up on gabapentin as they go. And the patients tell me, if I had known it was going to be this easy, I would have done this 3 years ago.
Wow. That's amazing.
Because at the end, they're on pretty high dose gabapentin, which we eventually taper them off of. But in the interim, they're not continuing to cause harm to their brain or their gut. They're not continuing to be at increased risk for pancreatitis or cancer, right? We've eliminated the risk immediately. And then over time, as their brain heals, because they're not drinking and because of what we're doing to restore their brain health, they come to us at 5 months typically and say, I don't think I need this much gabapentin. I haven't had a craving in 3 months. I feel completely great. I'm not drinking. I don't know. I feel a little woozy even on it sometimes. I feel like it's too much. When that happens, we start the taper
Mhm.
because it happens uniformly. And then we start them taper off. So by the end of the year, they might keep gabapentin in their desk or in their purse or in their pocket, just in case they're in an environment or situation where something comes up and it's a major trigger.
Mhm.
We teach them, have it in your pocket. And that way, if you go to a family thing and you're like, everybody's drinking heavily, go to the bathroom, take a gabapentin, go for a 10-minute walk. They come back, they can handle it.
Mhm.
So it's all things like that. Many different medications approaching, and patients have different psychiatric needs too. We have a psych NP and physician psychiatrists who will oversee all of their care as well, because every patient does have some psychiatric impact, either from the alcohol or underlying that was a part of why they developed the problem in the first
That
place.
makes sense.
So it's very interdigitated care. And the other aspects I would say that are radical different, it's from home. The whole thing is care in the home. And that's really, really important. I think in-home care changes the game. That's where alcohol use disorder happens, not in a resort. When you go away from work and your stressors and your children and all the things, right, and your spouse, that's kind of a separate from your world. Now you're back in your world immediately after with no help.
Mhm.
That's why they don't do well. We're in their home with them. Will they have a return to use in the first couple months that they're with us? Absolutely. That's part of the disease. But we're there. So the minute they have it, they call us. I had a patient Saturday, this weekend, who called at 11 o'clock at night because her husband had just been in a tragic motorcycle accident and she wanted to grab a beer in the worst way. And she called us because we're there at 11 o'clock at night on a Saturday. That's when they need
Mhm.
us, not an IOP for 3 hours getting lectured at 3 times a week. That literally does nothing for
Mhm.
patients. So the model is radically different. We're in the home with them. We get to know them, their families, their children. We have family meetings all the time through the whole year so that everybody knows this is a family system disease. We share the genetics with all of them and tell them what to tell their kids, right? It's very impactful. I can tell them how many of the 270 genes for alcohol use disorder that you have that caused you to have it, because they usually have 150 of them.
Wow.
If you have 150 genes making you drink alcohol and you live in the US or it's at your pharmacy, are you going to drink?
Yeah,
Probably.
yeah, of course, of course. I mean, I bet that your patient reviews and testimonials are absolutely phenomenal. I mean, because I'm sure a lot of people have, maybe tried other options too to like, I mean, most people don't get to the point where they're drinking, 17, 20 drinks a day without trying something to stop and it's failed them, right? So to go through a program like this, they can do at their home that's really like tailored to the individual and personalized in a way that really recognizes like every individual's like self-worth, I bet is just absolutely a game changer for people.
I would recommend, if you have any interest in learning more about our program, that you actually go to TikTok. As strange as that sounds, I'm too many gray hairs to be on a platform, but I am because my marketing guy made me do it. But we have now had 39 million views of our videos in the last 10 months. We're the largest, we're the most high ranking addiction program they have in their system because people hear what I have to say about this and, oh my God, there's hope. And I don't have to leave my children, and I don't have to leave my job, and my job doesn't have to know. Never mind that it's so individualized, it's down to their genome, right? So it's completely personalized care in the home. It's incredible. And you will see, we get 1,000 comments a month from people who read or see our videos saying the most wonderful things. And our patients who are now in the program who found us that way, go back and tell the other people, oh my God, I'm in it. It's for real.
That's amazing.
This is actually what they say it is. It's unbelievable. And that's what fills my heart. I'm a physician before I'm a CEO.
Yeah. How so
Yeah.
on TikTok, how would they find you then? Go just look up Northstar Care or Northstar.
Hashtag Star Care.
Okay.
Yeah.
Hashtag Northstar
Yeah.
Care. Perfect. Perfect. Well, I guess as we wrap up, just a couple of questions. So, one would be, so employers that are listening to this, what would you recommend in terms of next steps? It sounds like one, probably start thinking about alcohol and substance use disorder, in a way that you would like cancer or diabetes, where you're actually, recognizing this as a condition that's affecting a huge portion of your population, and you need to treat it with that type of with that type of focus. And then maybe secondly, I mean, it sounds like your methodology could really help them with building out kind of the business case and understanding the prevalence of this problem in their population. So we work with a lot of employers and a lot of brokers. And for those listening, would love just your recommendations on what they should be doing as the next step.
You bet. You bet. So we really want to, we put ourselves in really forming strategic partnerships. We want to be in this with you and really help your employees succeed and therefore help you succeed. So for the employer brokers or the employers individually, if they go and work with us, we can start just easily, and I will happily do this for free. My co-founder will run our data analytics. We'll be able to prove to you definitively and show you your data about how many of your employees have diagnoses like alcoholic pancreatitis that were hidden, right? And so we can pull that. We'll be able to tell you, number one, what your annual expense is for people without the disorder. Number two, what your annualized expense has been for the employees that do have it. Is it 300%? It is on average, more. And then what's their top 10%? What are those sickest patients costing you? And, there's a group of 20,000 teachers in upstate New York. When we ran it, 24.2% incidence. They had spent 19.5 million last year just on the top 10%.
It's crazy.
That was 20 million. We didn't even look at the other 80% that had the disorder. So even if we just focus there, we can start saving you money immediately. So we'll do the analytics, we'll meet with you, we'll describe it. You can decide whether this sounds like it's right for you or not. We'll even pilot with you. You can say, let's try 10 of my employees who are struggling with this that you found, so we can do things like that. And we're happy to do trials. I just want you to see the benefit of what this is. Or we're happy to just jump right in and help because frankly, it's such a massive problem and it's causing these downstream problems, the cancers, the heart attacks, the strokes, right? So we have to get ahead of that so that's not happening. And the medical is where you're getting hit hardest, not the behavioral, because only 8% go to rehab. You're getting hit on the medical spend, but you just don't know.
It's
So
fascinating.
that's a great way to start. Once we've got the data analytics, then we work with your HR team. We will bring up, my team will come out. Actually, I hired a person with HR experience to do this. They'll come out, they'll meet with the HR team. They will help them do an implementation. We have all the materials all ready to go. If it's a place where people are having a place of work and not working from home, we have little cards that you can hang up somewhere that say, want to drink less? And it just has a QR code. It's anonymous. You hang them in the bathrooms, right? I mean, there's ways to get the message out. Videos like this, or videos that we've done that we can give you, short videos, 3 minutes, that you can put on your intranet so the patients can say, oh, I'm struggling, or my son is, and they look it up, right? So that's a good early start. And then we'll continue to work with you on analytics and start showing you what you're saving. We really want to be a partner.
That's wonderful. Well, I mean, absolutely a phenomenal solution and just really innovative. I mean, it's exciting. Like we like to feature companies on this podcast that are so innovative and change makers and doing something different in the space. And this is obviously very, very long overdue and just something that's very needed in our society. So, I mean, it's not often that you speak to a company that's really, has the potential to drive such impact across, the full American population, not even just the employed population. So, in closing, Amanda, I know that we've been working together some, so wanted to see if there's any kind words you might say about your experience working with Spark Health Advisors. We always appreciate any shout outs or comments you might have.
Honest to goodness, I could not say enough. I mean, I'm so grateful you set aside a minute to do this because, I have said to this team before, I have never hired a consultant that has delivered like this team. Never. And I have built 3 companies. My first company had, 20,000 employees. It's like, I know how to do this and they are amazing. They are really in the weeds with you, that I neither of my previous companies took care of all addictions. They were focused on opioids, so it was a specific thing, and it was very different. I didn't work with employers back then. With this, it makes perfect sense to fully interdigitate and partner with them. And Lindsay and her incredible team are doing that with me, educating me along the way, and our whole team available when we ask questions. They're embedded in our Slack so we can communicate directly with them anytime we need to. They answer questions in a jiffy, and they in just 2 months have made at least a dozen connections for me already that are taking off, like more TPAs that I would have ever met otherwise, more employer brokers, right? They're just really helping us get this message out there that there's a new solution that could really radically change things. And so we're working with lots of broker consultants now, and several that you've brought to us, because the word's spreading. And we anticipate a very massive ramp next year, a massive ramp. We cost less than one rehab.
That's awesome. Well, thank you, Dr. Wilson. That's super nice of you to say. And I mean, I think that it is partly your solution is amazing. So, it's easy to help you. We love working with companies that really are doing something different and have something novel that they're bringing to market. And, it's easier to help those companies, certainly. So we're really excited about where you guys are going. And I can see you guys absolutely ramping up and doing great things in the coming years. So thank you so much for joining the podcast today. I really appreciate it.
Oh, it's my pleasure. Really great to speak with you. And I hope this has been helpful.
Thank you, everyone.